Willie D Live.
What the haters talking about?
What's up, family? In 2017, Redonda Vaught, a nurse who administered a deadly drug mix to one of her patients, was arrested and charged with murder. I ain't got no problem with that, but some of y'all do, so let's talk about it. The woman she murdered is Charlene Murphy, or was Charlene Murphy. Charlene Murphy was counting on Redonda and the people at the hospital to, show some professionalism, treat her right, take care of her, right? So how could something like this happen? According to reports in December 2017, Redonda Vaught administered Vicurium to 75-year-old Charlene Murphy instead of the sedative Versed. Murphy had been administered to the neuro ICU after suffering from a brain bleed. 2 days later, doctors trying to determine the cause of the bleed ordered a PET scan. Murphy was claustrophobic and was prescribed Versed for her anxiety, according to testimony. When Vaught could not find Versed in the automatic drug dispensing cabinet, check this out, fam, she used an override and grabbed Vicurium instead. How much you want to bet it happened before? At that hospital. Maybe not that exact drug, maybe not that exact patient. But family, you gotta watch yourself. You gotta be very careful for yourself and your family members, because there are a lot of incompetent people who work in healthcare. And that is no knock on the good people who are in healthcare, who work there. Some of you guys are great. You love your job, you love the patients. It's a very demanding job, so I salute you. I mean, we talking a lot of times you guys got to put in 10, 12, 14, 16 hours sometimes. It's crazy, but you do it. And you do it oftentimes without thanks. So thank you for that. But you uncivilized mutts who work in healthcare, I can't stand you. Family, and they got this code in healthcare. If you see something, you better not say something, because you'll get ran out of healthcare. And so a lot of times, these nurses and doctors and practitioners and assistants and all, these people, they don't say anything because, that's 6 years of medical school, 8 years of medical school, whatever, however much time you went for nursing, that's down the drain. So people are not willing to speak up. But I'm telling you, it is bad. It's way more pervasive than you could ever imagine. And here's how they get away with it. First of all, they make you sign those that make you sign that paperwork that says that they're not responsible in case something happens. You're already out here right there. It is very difficult to prove malpractice because the hospital is just gonna say, hey, when he came here, he was already sick. We was just trying to help him. And he died. In fact, when it came to Charlene, they said initially, they tried to call it cardiac arrest. And then they came back and said, after an autopsy, it was like, well, it's Vicurium. But initially, they tried to pass it off as a cardiac arrest. Because, hey, those type of things happen. People, it happens. But that's how they get away. Look, we was just trying to help them. We was just trying to help your grandma. you know, and she died. Don't blame us. You know, you brought her here for us to help her. We tried. We did everything we could, and she died. And here's another way that they get away with it. The lobbyists. The lobbyists are in bed with the healthcare system. They're in bed with the hospitals and the politicians. It's a big circle. The lobbyists, the politicians, the hospitals. It's very, very difficult to prove malpractice, but it happens every day, all over this country. And it don't look like it's gonna get any better because the nurses all over the United States was riding for her. They cheered the outcome. She actually ended up getting 3 years probation. She could have ended up with 6 years in prison. I don't know how you just get to get 6 years in prison. The family forgave her, so I guess that had some weight. It was like, you know, she's really forgiving, and my mother was a forgiving woman, and she would have forgave her. So that's what the son said. My mother was a forgiving woman; she would have forgave her. So they forgave her. The family forgave her, and she could have did 6 years, but the judge gave her 3 months, and she broke down crying in gratitude, and nurses all over the country celebrated. But a woman died who didn't have to die, and nobody paid for that crime. And let's not talk about the hospitals, how they overwork these nurses. So I'm not saying that it wasn't a mistake, but the nurses have to be held to a higher standard. Lives are on the line. When you are in a position to where you can destroy somebody's life, where you can change life, where people can die, you should be held to a higher standard. The hospitals got to stop overworking these nurses also. There's enough blame to go around here. But the nurse absolutely have to take accountability. Mistake or not. You don't get to just make a mistake and somebody die and you don't pay for it in some kind of way. America is a prison system country. They like sending people to prison. I mean, this is part of the game, man. We want to send, you got to go to prison. Especially you kill somebody, you got to go to prison. But they spared her. I wonder why. Can you guess, boys and girls? Hit him with the Mr. Rogers. Can you guess why they spared her, boys and girls? Drop a comment. I'd love to hear your thoughts. No more talk.